Jackie, thank you.
Yes. So I am working for the WA Association for Mental Health, and it's the peak body for community managed mental health services. And as Donna said, I'm new to WA, I'm new to the sector. I started in the role late September last year. So I'm also quite new to the mental health bill. And in my previous role, I worked in the community legal sector doing law reform advocacy. So I guess some of the things I can offer today are around strategies to I guess, advocate for changes to the bill. On the positives, so I think the insertion of a whole new part that deals with notification of key events is a very positive steps, noting the limitations that Sandra has spoken about. So, and to me, I think the Carers WA and the carers community in general should be really proud of the fact that that section has made its way into the bill, even though there may still be improvements to come. I'm familiar with the fact that for a very long time carers have felt like they're not informed properly of where people are at, of where their loved ones you know, the nature of the orders that their loved ones are under, and that will be an incredibly stressful situation to be in. So the fact that you fought for it and you've got it there, I applaud everybody for that achievement. The second positive thing that I identified was the express reference in the Act. It's a new section, I think it's Clause 8, express reference to the duty to seek the patient's wishes about their treatment and other related issues. That should really go without saying, but I think when things are clearly stated in law in such positive language, that can have a transformative effect the way things are done. And so that stood out to me as a positive. The third positive that I identified was the expansion of the categories of people that can be included as support people for patients of care. So people, it now extends to the idea of a close family member and nominated persons. And there's also, I'm not sure if this provision was in the 2011 bill, but there's also specific recognition of the unique family relationships in Aboriginal families. And so there's an express requirement to consider how those unique family dynamics might be relevant to somebody identifying their close family member as a person that they would like to keep informed. And I think that's a really positive step. Some of the things that stood out as a bit concerning to me. So the government, the Mental Health Minister, released a document explaining some of the changes to the Green Bill that have been made since the 2011 bill. And in that document it says that there's now a right to legal representation. If you look at sections, this is really dry, but if you ever want to look at it, it's sections 429 and 430. The wording of that Act doesn't create a right to legal representation. It creates a right for somebody to request legal representation, and then the tribunal may adhere to that request. The language is not obligatory, so if someone puts in a request, I would have liked to have seen the Act require as a must for a legal representative to be appointed. But to me, the current reading of that Act seems a little bit unclear, and it's possible that the tribunal could exercise its discretion to the contrary. And also what Sandra was saying before, the right in its limited form to legal representation is not extended to children. And there are some really good reasons about why legal representation is so key for tribunal hearings. And I'm familiar with some stats coming out of Victoria, where I'm from. People who do receive legal representation have far different outcomes from people who don't. And they often have their orders re-examined, processes looked at in closer detail compared to those that don't. And so the evidence is really clear that legal representation is absolutely key. The concept of okay, in the context of determining whether somebody is an involuntary patient, should be put on an involuntary order, I'm really concerned about the phrase unreasonable refusal of treatment. So, unreasonable according to who? And what factors go into determining whether or not somebody's refusal of treatment is reasonable or not? It's a very broad discretion, and it's unclear to me about who gets to make that decision. The last thing that I will highlight, so the establishment of the mental health advocacy service is a really great step. My concern is that the close relationship between the mental health advocacy service and the ministry could at the least give rise to a perception that the advocacy service isn't as independent as it should be. And under international law, when you're talking about advocacy services and services that are responsible for monitoring compliance with laws, they're meant to be as independent as possible. And it's certainly really important to have a relationship with the minister, but it should be a standalone independent service. That's it. I've had my go.